Well, now an update on the coronavirus in Maryland. The state's positivity rate dropped again today. It is now at 3.08%. Governor Larry Hogan says it is the lowest 7-day average since the pandemic began. Now, here are the new numbers from the health department. Maryland has recorded nearly 103,000 cases in all. More than 3,500 people have died. Tonight, doctors are still treating 455 patients in the hospital with the virus, and 102 of them are in an intensive care unit. Well, as researchers across the world rush to develop a safe COVID-19 vaccine, questions are beginning to emerge about who will get that vaccine first. Researchers at Johns Hopkins have released recommendations about who should be first in line. And WJZ's Live, Avajoy Burnett tells us why essential workers and people with pre-existing conditions, of course, at the top of the list. Avajoy?
Well, experts at Johns Hopkins University are saying the essential workers were exposed to the virus every single day. They should be at the top of the list to get the vaccine. Worldwide, COVID-19 cases continue to tick up. A Johns Hopkins tracker says more than 22 million people around the world have tested positive. As researchers rush to find a safe vaccine, the question is, who will get it first?
I think that there is certainly general consensus from my perspective that, frontline workers need to be part of the initial rollout.
Experts at Johns Hopkins have come up with a list which includes essential workers involved in the COVID-19 response, people at high risk for getting sick or dying from the disease, and their caregivers. Carly Krubiner helped to develop the recommendations.
If we don't have basic ways to enable the food supply or other essential functions of society to keep going, then everybody will be harmed.
750,000 people have died from the virus worldwide, and more than 3,500 people here in Maryland, including Dr. Joseph Costa, the chief of Mercy Medical Center's Critical Care Division. A tragedy which underscores frontline workers are vulnerable.
What's at risk if the vaccines go to the wrong people?
If we don't strategically allocate vaccines, we're not going to be able to control the pandemic as quickly as we could under alternative strategies.
Now, doctors saying a reasonable timeline for widespread availability of the vaccine will be sometime next year at the end of 2021. Live at 6, Avajoy Burnett for WJZ.